the important guidance from CPC Central Committee and the General Secretary Xi Jinping, we have put the prevention and control work as our top priority. We strengthen the responsibility and leadership. We lead all the parties and the localities to fight against COVID-19. We also sent task force to go to the front lines for the prevention and control. We also mobilize experts to provide support to different places. We also organize systemic meetings to provide guidance to different localities. We have sent out the 20 task force to visit different places to plug the loopholes and fight against COVID-19. In view of the current situation, we have to take stringent measures for the prevention work and also to make sure that we could prevent imported infection. We also roll out closed-loop management for high-risk regions. We are also rolling out overall disinfection to key premises and facilities. We need to pay attention for the centralized quarantine for key populations so as to curb the spread of the virus. Here I would like to give all of you the reminders. Please cooperate with our work and exercise stringent measures on the prevention and control. We have to minimize the duration for the spread of the virus so that we can bring our life back to normalcy. As of August the 12th, 1.82 billion doses of vaccines have been administered. We have over 770 million people completed the vaccination. So today, our theme is the containment about the epidemic. We have Mr. He Qinghua from Disease Control Bureau of National Health Commission to join us, and also we have Mr. Gao Guangming, the DG of the Department of Primary Health of National Health Commission, Mr. Wang Huaqing from China CDC, and the head of the Residents Committee from Chaoyang District, Madame Hou Bing, and also we have Mr. Li Yongji, who is the head of the Jinsong District, and they will answer questions and give you the latest updates about the epidemic. Now the floor is open for questions. Please announce your media affiliation before you raise the question. With People's Daily, start from late July, we found sporadic cases. Especially, we found the outbreak in Zhangjiajie and Yangzhou. So what is the current situation of the epidemic? How can we take further measures to contain the epidemic? Thank you. Now I would like to give the floor to Mr. He Qinghua to answer your question. Thank you for your question. Recently, the epidemic occurred in multiple cities in China, also draw public attention. As of August the 12th, we have 80 provinces and 48 cities reported local cases. The total number of confirmed cases is over 1,800 cases. Among the 48 cities, for 36 cities have 0 cases reported for more than 5 days. For Yangzhou, Wuhan, and Zhangjiajie, except for these 3 cities, for the other cities, they only have very few sporadic cases reported every day. That said, for 48 cities, 36 out of them registered 0 cases for more than 5 days, except for Yangzhou, Zhangjiajie, and Wuhan. These 3 cities may have some confirmed cases. For the other places, they have very few cases reported. That is to say, in general, the epidemic is controllable in China. We also have very low risk to have a large-scale outbreak of the epidemic. And also, the Disease Control Bureau of the National Health Commission will guide localities on the following work. So first, for places with outbreak of epidemic, they have to exercise all the measures under normalized prevention and control. They need to continue their work for the virus tracing, epidemiological investigation, make sure that people from these places will not travel to other cities. This is to those cities with confirmed cases. So for the other cities, they have to do a screening for people who may have some relation of the epidemic so that we can identify the potential infected patients so as to minimize the risk of an outbreak. And also, we have to pay attention to key facilities, for example, the airports, docks, expressways, and highways. And also, we need to pay attention to medical institutions. We need to find out the weak links and also the loopholes, making sure that there's no other imported infection. Fourth, we have to strengthen the publicity and education. We should guide the individuals to form healthy habits, for example, wear masks, wash hands frequently, and exercise 1 meter social distancing. By doing all of that, we could contain the spread of the epidemic. Thank you. Next question, please. With CCTV of CMG. Community is actually the front line to fight against the epidemic and also for the prevention and control work. For this round of epidemic, in face with the Delta variant, which may have a fast transmission. So what measures will be taken by the community? What other measures will be taken by the community for the prevention and control work? I would like to give the floor to Mr. Gao Guangming to answer your question. Indeed, you have mentioned the community prevention and control is of great importance for our overall work. So in the past few months, we have learned lessons in our previous good practices, and also we have come up with a number of measures. So for the community prevention and control, we need to do a good job in the joint prevention and control. So I have to mention 5 things. First, we need to mobilize all the available resources. We also need to dispatch the party leaders to go to the communities to facilitate with the work. Second, we have to do a good job in the prevention and control in community. For example, we'll focus on the grid management. We'll also give education to people who are living in those communities, especially for those people who are living in the risky areas, making sure that there's no gathering, there's no cross-infection. And also we need to do a scientific environmental disinfection, making sure that we can prevent the virus transmitted to person, objects, and the environment. And third, we have to provide sufficient services to the residents. We need to provide support to ensure their livelihood. So for people who are living in the lockdown areas, we need to provide supplies to these people, especially the daily necessities, and also we need to make sure that we could provide electricity, utility, and water supplies. And fourth, we need to pay attention to the medical services to people living in the undone areas. We need to give good use of the home doctors, and these people can provide some basic medical services to those people, especially to the elderly people, the children, and the pregnant women. All we are doing that is to make sure that all the residents can seek medical help when needed. Fourth, we have to pay attention to the centralized quarantine areas. For the quarantine areas, it is of high risk. So in those quarantine sites, we need to have experts to check the situation of those quarantine sites. So for the quarantine sites, they also need to set up special areas and also special channels to mitigate the cross-infection. Fifth, we need to monitor the health condition for all the residents. For all the infected patients, some of them are asymptomatic patients. But for some of them, they may have developed some symptoms. We need to do everything we can to identify these asymptomatic cases as early as possible. By doing that, we will be very proactive in the prevention and control work. So I hope all the localities, they could establish a guidelines to monitor the screening of the asymptomatic cases. And also as for the Delta variants, which also have a strong infection, you're also asking what other measures we're adding for the community prevention and control. For the Delta variant, it has very fast transmission. So we need to take rapid actions to curb the spread of the Delta variant. So by taking all the stringent measures, we need to be very fast to exercise all of those measures. Before the virus being spread to other places, we need to build a safety net for the community. First, we need to take a science-based approach. We need to take decisive actions. We need to make use of the big data to identify the risky areas so that we can better manage the mid and high-risk regions. We need to take up customized strategies in different regions. The ultimate goal is to minimize the scope of the transmission. And the second, we need to have a fast reporting system. For the medical system, we always advocate the pre-triage. We need to identify the high-risk patients who are seeking medical help in the hospital. Also, this also applies to the supermarket, wet market, as well as the drugstores. So for these facilities, they need to come up with contingency plans. When they identify suspected cases, they have to report the situation to the upper level. And also we need to have a committee to organize the prevention and control work. Third, for high-risk population, we need to bring these people, for example, the close contacts and the secondary close contacts, to centralized quarantine as soon as possible. As far as we know, in the past, we bring the close contacts to centralized quarantine within 24 hours. And right now, this time has been shortened to 8 hours. 8 hours seems like a long time. However, we need to do a lot of work before we bring these people to centralized quarantine site. Because after the local authority receive the list, they have to verify the information with the local community. After they confirm this information, they need to have a phone call with the person involved. And then we need to run an epidemiological investigation to these residents to get some basic knowledge, basic information. And also we need to collect samples for places where these suspected cases live. After we confirm all this information, and then we will send out an ambulance to bring all of these people to designated hospital for treatment and quarantine. And fourth, we need to have a fast information flow. We need to have a seamless information transmission system, making sure that we could receive the most accurate information timely. For nucleic acid testing, for example, we are doing a mixed test for 10 people. It is easy to identify which one is the patient, but if the number of samples reach millions, it is very difficult for us to identify which one is the patient. So that said, we need to have a very effective information system. Without such an effective system, we have to go back to millions of people. So it's very difficult for us to identify the virus and the patient. And also we need to share the travel history of all of these infected cases. And we have to report this situation within 24 hours. Thank you. Next question, please. Thank you. With Hong Kong media, we are aware that in multiple cities, they are rolling out vaccination to people between 12 years old and 17 years old. Can you tell us more about the rationale behind it? I would like to invite Mr. Wang Huaqing to answer your question. For teenagers and kids, they're susceptible groups of people. That's why, on a global scale, we started to roll out vaccination to this group of people. We have considering 4 aspects. At the earliest stage, we may think the incidence rates for the kids and the children are quite low. However, when we are seeing the spreading of the virus, especially in high-risk regions and high-risk countries, we are seeing more and more children get infected. This is one aspect because this group is vulnerable to the virus. Second, after children get infected, in the past we think they generally develop light symptoms, but now as we see more children get infected, we found some children develop severe symptoms, and some of them even lost their lives. Third, for adults and the teenagers, once you are infected, you become the source of infection. We have to manage and control the source of infection, including children. Fourth, right now we are taking some measures to cut off the transmission route and control the source of infection. In many countries, we found the epidemic is not controlled. Because in the ideal situation, we do want to build a herd immunity. And children are an essential part for us to build that herd immunity. Thank you. Next question, please. Thank you. With the finance channel of CMG, as Mr. Wang Huaqing just introduced with us the rationale behind the vaccination to teenagers, my question is, right now we are starting to roll out the vaccination to people between 12 years old to 17 years old. What is the current progress? Thank you. I would like to invite Mr. He Qinghua to answer your question. Thank you for your question. According to the deployment for the vaccination program in China for different provinces, they have started the vaccination to people between 12 to 17 years old. First, for different provinces and cities, they have formulate a working plan to roll out the vaccination to people between 12 to 70 years old. They need to get a general situation. Also, they reach out to the parents of these children. Second, different provinces have also allocated designated places for the vaccination to these people. Third, they have abided by the working guideline for the vaccination and also to provide support to the vaccination to ensure that the vaccination is safe. If some of the children there started to develop adverse reactions, we will provide more education to these people. Because for some of the children, they're easily getting panic. We have to provide some counseling to this group of people and give them more scientific information about the vaccination. But all in all, the vaccination is going well. Among 31 provinces, right now, over 60 million doses of vaccines have been administered to teenagers. Going next, we still need to put safety as our top priority, and of course, we will continue to roll out the vaccination to people between 12 to 17 years old. Thank you. Next question, please. With Xinhua News Agency, right now we found cases occurred in multiple cities, and these cases are actually infected with Delta variant. My question is, how can we protect ourselves, and what measures will be taken to protect ourselves against the Delta variant? Thank you very much for your question. So each one of us should be responsible for our health. So during the epidemic, we have to protect ourselves. In view of the current situation, in order to guide the prevention and control measures for key premises, key facilities, and key population, we have revised several guidelines. In the past, we only have 65 articles, and right now we have increased this amount of articles to 85 articles. We also adding more details on the guideline on mask wearing for the public and the key population. And for the key premises, facilities, and population, we also included the items into 10 categories. For example, we specified the guidelines for the prevention and control work in the airports, docks, expressways, national road, and communities. And as for the key population, we are also including this population to 10 categories, also including, for example, the security guard, cleaners, loading workers, etc. At the same time, we are revising some of the items on the guideline on mask wearing for the public and the key population. For people who are working in high-risk positions, medical workers, and persons who are working in high-risk areas, we are posing new requirements. For example, in the outdoor areas with densely populated areas, we advise all the residents to wear masks. In the past, we do not advise people to wear masks in public facilities, but right now, even though you are in the outdoor areas, we still advise you to wear the face mask. And also, if you are going to hospital, make sure you wear the face mask. For people who are working in the high-risk occupations, make sure that you wear N95 face mask. For medical workers and people who may have some contact of the virus, for example, the cleaners, nurses, we require these people to wear N95 mask throughout their work. For security guards who are working in the hospital, they also need to wear the surgical mask. For people who are working in the public facilities during their work, they have to wear the surgical mask. After we make revisions to these relevant guidelines, this will better protect key population who are working in the risky areas. This will also help us to roll out targeted measures in key premises and facilities so that we can cut off the transmission route. As for the content for the guidelines, please visit the official website of the National Health Commission. Thank you. Next question, please. With CMG, in Beijing, actually, some of the residents, they are actually returning back to Beijing from mid and high-risk regions. According to the regulation in Beijing, so for some people, they have to stay at home for observation for 14 days. So my question is to local communities. What measures will be taken by the local communities to ensure that their daily life could be in a normalized situation? Thank you for your questions. This is very important for us to provide services to people who are staying at home for quarantine. We are doing 5 aspects of work. First, we will give them a written commitment. So first of all, we will reach out to those people. We will send out this commitment letter. And also, we ask these people to receive nucleic acid testing and stay at home during the quarantine period. Second, nucleic acid testing. When these people are staying at home, the community will work with experts to roll out 4 times of nucleic acid testing to these people. So for the NAT will take place on the first day, fourth day, seventh day, and the 14th days during the quarantine period. And at the same time, we will collect the environmental samples for those people who are staying at home. And also, we will do a good job in the prevention and control for the virus transmitted to person and the objects. We also need to use the information technology system to understand the activities of people who are staying at home. So every day, we will reach out to these people to make sure they stay at home. And also, we will have to work with one community worker and a volunteer, as well as a medical worker, to observe the situation of those persons who are staying at home. So we need to check their body temperature twice a day and also to get a basic understanding about their physical condition. Fifth, we will register and upload the information of these people. For some people, they're going back to Beijing from mid and high-risk regions. Their health score will turn into yellow. So after 14 days, after they are tested negative for the very last NAT, and then his or her health code will turn from yellow to green. Second, I will answer your second question, how to provide services for people who are in home quarantine. In order to ensure the basic livelihood for people who are staying at home for quarantine, we will work with party officials and the community workers to provide daily services. For example, we will help them to collect the delivery packages, and also we will clean the garbage for them, and also we will try to buy some food and other daily necessities for these people. And for some of people who are staying at home, if they're panicked, we'll also provide psychological counseling to ease their nerve. Thank you. Next question, please. With Hong Kong Zhongping, we found recently there are cluster outbreak in multiple cities in China. My question is how we control the group of people who have returning to Beijing from high and risk and mid-risk regions. I would like to invite Li Yongjing to answer your questions. In order to do a good job in the prevention and control in Beijing, we will exercise measures from the municipal government for places with infected cases and people, if they're coming back to Beijing, if one of them are close contacts or secondary close contacts, for the communities, we need to bring these people for home isolation and home quarantine. And also, we will follow the Beijing regulation on prevention and control to monitor the situation of this group of people. We need to verify the list of individuals, and also we have to do 2 rounds of screening for these people. And we have to make sure these people will stay at home for at least 14 days of quarantine. For people who are returning to Beijing from mid-risk regions, these people will also have to stay at home for quarantine for 14 days. And also we observe their health condition throughout this period. We have to educate these people for the measures on the home quarantine. For people who are not able to attend to themselves, we will visit their households and to roll out nucleic acid testing to these people. If they develop symptoms, we will roll out a closed-loop management for these people. Next question, please. Results Weekly paper. Right now, we found all the local cases were actually infected from imported infections. So my question is, what measures will be taken by us to prevent the imported infection? Any adjustment? Thank you. I would like to invite Mr. He Qinghua to answer your question. Thank you for your question. Recently, we do see cluster outbreaks in multiple cities in China. According to the results of the epidemiological investigation and virus tracing, all the virus is actually coming out from overseas. So we have to make sure that we prevent the imported infection. By doing that, we can cut off the transmission chain and contain the epidemic inside of China. As of now, if we look at the prevention and control measures to prevent import infection and domestic emergence, they are proven effective. However, we still learn some lessons through this epidemic. First, we need to clarify the responsibilities for jurisdictions. We need to build up a joint prevention and control mechanism, making sure that we can exercise 4 early measures to identify these cases as early as possible, report these cases, isolate these people so that they can receive treatment as soon as possible. Also, we need to pay attention to the responsibility to all the localities for the prevention and control work. We have to provide more details for all of these prevention and control guidelines, making sure that all of these measures are feasible. Third, we also need to clarify the responsibilities for different levels of the government, making sure that we can prevent the virus entering into person, objects, and the environment. For high-risk population, we need to conduct closed-loop management for these people. Once we found the weak links, we have to rectify these issues as soon as possible. Fourth, we need to educate the public so that they could mind their own safety and take effective measures. For high-risk population, they have to wear masks, wear goggles, protective suits, so as to protect themselves during their work. And also, we advise them not to have contact with their family members during this period of time. All in all, we have to take stringent measures to prevent imported infection and domestic reemergence. Thank you. Next question, please. With China newspaper, some parents, they are worried that for some of the teenagers, after they're getting vaccinated, there may be some adverse reactions. I would like to understand what are some of the adverse reactions for the teenagers. What's the difference? Thank you for your question. Mr. Wang Huaqing will answer your question. As Mr. He said, right now, over 60 million doses of vaccines have been administered for teenagers in China. We are also monitoring the adverse reactions occurred in these teenagers. So actually, the adverse reaction rate is within a reasonable scope. After the teenagers get vaccinated, some of them may develop side effects. For example, they may have developed fever or sour muscle, and some of them may be allergic to vaccines. This is rarely seen, but for some of the teenagers, they may have this kind of adverse reaction. Actually, this is a very light adverse reaction. So all in all, the situation for the adverse reaction for the teenagers is the same as the adults. For some of the teenagers, after they get vaccinated, they may develop some normal reactions. With our monitoring, we found for some of the teenagers, they may have some reactions. This is not a part of the adverse reaction. So during the vaccination process, so for the parents, I would say please be relaxed. And also, please comfort your children and comfort your kids. So these children will not get panic after they get vaccinated. Next question, please, with Phoenix TV. Some people are saying that we have invested a lot for the vaccination, for the COVID-19 vaccine, and for people, if they want to receive vaccines of other categories, they are not able to receive the doses. So my question is, what measures will be taken by Beijing municipality and the NHC to roll out the vaccination of other categories? So first, I would like to invite Mr. Li Yongjing to brief us on the situation in Beijing, and later I would like to invite Mr. Gao to add on some of the comments. For different communities, they may have different arrangements for the vaccines. Of course, we have to pay attention to the COVID-19 vaccine as well as the vaccination for other categories of the vaccines. So first of all, we will separate these vaccination sites. Since we kick out the implementation of the vaccination of COVID-19, we're still doing a lot of vaccination, some other types of vaccinations to children and elderly people. The district CDC also provide trainings to people who administer COVID-19 vaccine. And also, we are offering a lot of help to the clinics and other medical institutions to provide vaccination of other categories. Also, we are launching an online platform so that the kids, before they get vaccinated, they could make appointments before they go to the hospital. We only allowed one parent to enter into the vaccination site to accompany the kid. Thank you. Mr. Gao. In the first half of this year, we have over 40,000 grassroots medical institutions to roll out COVID-19 vaccine. So most of the COVID-19 vaccine have been administered by grassroots medical institutions. So I believe over 1 billion doses of vaccines have been administered from the grassroots medical institutions. And also 1.4 million of medical workers have been participating in the vaccination progress. Right at the beginning of the epidemic, we have already sent out notification to the grassroots medical institutions, even though we are putting the vaccination of COVID-19 as the top priority, but at the same time, we still need to pay attention to administer vaccines to children between infant to 6 years old. Because of the epidemic, some of the immunity system may be undermined for the children, so that's why we still need to pay attention to the immunity vaccines to infant to 6-year-old children. According to our statistics, every year, the grassroots medical institutions will administer over 200 to 300 million doses of vaccines to 0 to 6 children. And actually, last year, the number reaches 280 million doses, which is a quite average. And also for the first half of this year, if we look at the figures, we are also rolling out the vaccination program in an orderly manner. So as you raised the question, maybe some people are not able to receive the vaccines of other categories, meaning that in the future we still need to take stringent measures for the vaccination work. making sure that all the kids can receive vaccines when necessary. I also want to advise the parents of the kids, please reach out to the local medical institutions. And if you have a sign up with a private doctor, please report this situation to the private doctor. I'm sure all the grassroots medical institutions are able to provide vaccines of other categories to these kids as needed. Thank you. Next question, please. With 21st Century Economic Daily, as of July the 13th, 30th, the vaccination rate in Beijing above 80 years old is about 92%. I believe community has played a key role in the vaccination programs. So any experiences to share with other cities from Beijing? I would like to invite Mr. Li Yongjing to answer your question. During the vaccination process, actually, we have received a lot of support from the National Health Commission. For the District Health Commission and also the District CDC, also provide a lot of inspections and guidance for the vaccination. We have setting up a number of vaccination sites to ensure an effective vaccination to Beijing residents. Second, we also have a lot of mobilization and motivation to the local residents. We try to educate the local residents what are the advantages for you to get vaccinated and what are some of the adverse reactions. So for some of the vaccination sites, in order to increase the vaccination rate, those communities also provide some incentives to the local residents. For some of the vaccination sites, they also have some volunteers. They are educating the residents on some of the tips and reminders. And fourth, we are working with the vaccination sites, and also we arrange vehicles to transport the residents to go to the vaccination site, making sure that they could receive the vaccination in a convenient way. Especially for the elderly people, we also come up with a specialized service plan to these people. For people who have completed the first doses, the local community will also send out reminders through text messages to these residents so that they would receive the second doses in a timely manner. Thank you. Next question, please. With Yangcheng Daily, my question is about the vaccination to teenagers. So right now, according to the current regulation, we advise parents to be with the teenager. What are some of the reminders for the teenagers to receive the vaccine? I would like to invite Mr. Wang Huaqing to answer your question. It is very important for us to roll out the vaccination to teenagers and kids. Actually, it is the same practice as we roll out the vaccination to the adults. According to our regulation, for the doctors, they have to do two things. For the teenagers, the vaccine recipients, for example, we need to inform the recipients on the safety of the vaccines, the types of the vaccines, and also the functions of the vaccines. And second, for the doctors, they have to get a basic understanding of the health condition of the vaccine recipient. However, for children under 12 to 17 years old, they're not adult yet. So that's why we need to have one parent to be with this teenager so that they can provide the information that needed by the doctor. For the vaccination to the teenagers, we advise the parents to go with their kids. First, before the vaccination, the parents need to have a basic knowledge about the vaccine and get to know about the procedures of the vaccination. And during the vaccination, the parents should bring valid IDs for the children. And before they go to the vaccination site, they need to have a good understanding of the health condition of their kids. And when they're arriving at the vaccination site, they need to inform the doctors about some of the taboos and some of the vaccination shots in the past. All this information will be very important to the doctors so that the doctor can make a decision whether or not to administer vaccines to the kids. And also the kids, after the vaccination, they have to stay at the vaccination site for 30 minutes for observation. And during that 30 minutes, if these children develop some symptoms, the parents should report to the doctors. If they develop severe symptoms, we have to send these people to hospital for further observation. Thank you. Next question, please. With the finance paper, I believe it is very important for us to manage the close contacts and the secondary close contacts. My question is to the district representative in Beijing. If we found some of the close contacts or secondary close contacts of the confirmed cases in certain communities, how we manage this group of people? For close contacts, we need to hear technical feedback from local authorities. We also need to work with the District Health Commission and the District CDC to manage this group of people. First, we will reach out to those people as soon as possible. After we receive the list of the close contacts, the community will work with the medical workers to reach out to that close contact to inform him or she about this information. And the second, we will advise them to stay at home for further notice. And they should prepare protective gears and wait for the arrival of the medical workers. For some of the residents, they're getting panic after they're informed as close contacts. So at this point, we need to provide more education about the policies to these people. Second, for the medical workers and the community workers, we will visit the household for the close contacts. We have to collect samples from the environment, and also we need to roll out nucleic acid testing to these people. And at the same time, we will dial 120 and to transport these close contacts to designated places. After the ambulance arrives, we will require the close contact to wear a mask, and then we will bring these people to designated places for quarantine. Fourth, we will do overall disinfection by no time, especially for places and homes, elevators that have been visited by the close contacts. We will roll out disinfection to all of these places. As for the secondary close contacts, we will also manage this group of people as soon as possible. Due to the interest of time, 2 last questions. With Hongxin News, if we look at the cluster outbreak right now, I would like to understand what are some of the loopholes in the community prevention and control. What measures will be taken to plug in all of those loopholes in the community prevention and control? Mr. Gao Guangming, as you can see, we do have some cluster outbreak in different cities, and there may be some weak links in the community prevention and control. If we look closer to all of these situations, we are seeing actually they're exercising the prevention and control measures. So why still we have all of these outbreaks? This is because for some localities, they are not paying enough attention to the prevention and control. They are slacking off their efforts in the prevention and control in exercising all the measures. They do not have a good awareness for the prevention and control, which leads to the failure in exercising all of these measures. For some measures, even though they're implementing those measures, however, they're not taken a stringent attitude, a stringent manner. When the epidemic comes, this will actually cause a loophole in the community prevention and control. So this requires all the local officials and the residents to stay alert. We have to find out all of those loopholes and making sure that we could exercise all the prevention and control measures thoroughly. And also, we need to give full play to the joint prevention and control mechanism in the community. We have to clarify the responsibility for 4 parties. No one is left behind for the epidemic. We need to build up this joint prevention and control mechanism so that we could be more effective in exercising our measures. By taking this opportunity, I would like to emphasize that for the community prevention and control, we need to be scientific. We need to take scientific approach. And we should learn from the experiences from different cities. For example, in Beijing, Heilongjiang, Shenyang, as well as Nanjing, we are rolling out the thermometer plaster that could be operated in 24 hours. For some of the infected cases, there may develop symptoms as fever. For example, if their temperature is really high, and then his or her information will be captured by the 24-hour AI thermometer. As it operates for 24 hours, meaning that once it identifies some unusual temperature, then it could identify the fever patient. So it is quite proactive for us to identify the fever patients and to bring all of those high-risk population to quarantine and treatment. And for some of the communities, they advise all the residents to stay at home. In the past, we are not able to monitor the health condition for each one of the residents. In the past, we visit every one of the household. I think it is quite low efficiency. And right now, we are actually installing alarm system so that once a fever patient was identified, and then we will receive an alarm. As I said, we need to have a scientific approach for the prevention and control. That means we need to make good use of those high technologies. By doing all of that, we are able to deal with the Delta variant. Yes, indeed, each one of us should participate in the fight against COVID-19. One last question. With cover news. Recently, in Beijing, we found some of the cases have some related to other cities, and right now the situation is still very severe. I would like to understand what measures are taken by the medical institutions in Beijing, and also what measures will be taken by the community to prevent the imported infection. I would like to invite Mr. Li Yongjing to answer your question. First, we have to enhance our awareness for the prevention and control, making sure that the prevention and control is our top priority. We also clarify duties to different parties, making sure that each section will be accountable. And also we have to make sure that there's no inter-hospital transmission of the virus. We need to find out all the weak links to make sure there's no virus inside of the hospital. And also we are using the travel card and also the health code to identify the situation of the local residents. We are also rolling out the pre-triage and also do a good job in the patient transfer. For people who are coming to Beijing to seek medical help, we have to manage their health condition. Once we identify suspected cases, we will bring these people to centralized quarantine, and also we will transfer this patient with ambulance to fever clinics. And also, we roll out a closed-loop management to screen out all the fever patients. And also, we need to manage people who are working in the public facilities. For people who are working in the high-risk areas, every 1 week we will roll out the nucleic acid testing. And also, when we are providing services to people who are living in the community, and we need to make sure that their health code is valid. And if some people have a yellow code or a red code, we do not advise these people to provide public services. And we will follow the prevention and control measures from the leading group. At community level, we will roll out nucleic acid testing to people who are working at the grassroots medical institutions, making sure that there is no transmission of the virus inside of the medical institutions. Thank you, Mr. Li Yongjing. Thank you, all the speakers. And today, our speakers talk about our containment efforts under normalized prevention and control. Especially, they talk about measures taken by the community prevention and control, as well as the vaccination process for teenagers. Thank you for your introduction. And later, we will organize more press conference to brief you the situation about the epidemic. That's the end of the press conference. Thank you.